Day-long dive into mental illness in Oklahoma continues this midday. We're working for you to bring awareness to the issues and cost of mental health in the state. We also want to bring resources available to those who suffer. Joining us now this midday is Mark Davis. He's the co-director of Housing and Recovery Services at the Mental Health Association of Oklahoma. Thank you for joining us this midday.
You for having me.
All right, well, first up, what are some of the misconceptions about mental health?
Well, I think one of the things that comes directly to my mind is that, mental health issues are something that can't be treated, when actually with the proper treatment and services or access to services, that mental health related issues are actually very effectively treated, and people can live very productive, healthy lives and have families and participate in higher education and go to school and have stable jobs and a great deal of independence and self-sufficiency. So I think that's one of the probably more common kind of misconceptions, is that once you're ill, then that's the end of it. That there's no hope, when actually there are always greater days later for people who have or are struggling with mental health issues.
Well, that's great. And as I mentioned, you are the co-director of the Housing and Recovery Services.
Yeah.
How does your specific organization help people?
Well, I think I'm going to start kind of broad to answer that question.
Okay.
I think one of the things that we really focus on is really bringing awareness and education to people across the city, but across the state, in regards to what mental illness is. There's a lot of stigma around mental illness. There's a lot of stigma around whether or not individuals who are living in recovery are dangerous or violent. Many people aren't really knowledgeable about what services are out there, what treatment is out there. So our goal as an agency is just to educate people in the community, to let them know there are resources out there. People can be productive in their own right and in their own lives, and that's really what we do as an agency. We do have counseling programs, we have employment opportunities for people, and of course we also provide, we're one of the largest providers of housing services for people who have mental health issues as well. So that's one of the we're kind of nationally recognized, if you will, in providing safe, decent, and affordable housing to people who are having difficulties accessing, housing services. That's
wonderful. And if someone needs housing, how can they get in contact with you guys, or what do they need to do?
Well, first steps first. I would recommend them call our main office number, which is 918-585-1213, and that will, our representative there will get them to the right housing and referral coordinator to help them set up an application and then go from there. So it's a very easy step-by-step process.
Okay, great. So just head to the website or call the number?
Most definitely, yeah.
Well, thank you for joining us this afternoon, or this midday. It's before noon still. We've been here all day. Well, we have much more coming up today during our day-long mental health initiative. At 5 and 6, our experts will be waiting for your calls to answer any questions that you might have about mental health. And for more information on the different conditions, you can visit our website, kjrh.com.